So previously we have discussed about sleeve gastrectomy. So now I'll come to the other surgery, gastric bypass. Usually there are many types of gastric bypass that are done. It depends on surgeon, it depends on patient, what do you want. So I'll explain the most commonly done and a very effective procedure. So I have told you previously that in sleeve gastrectomy there are a couple of limitations. Like number one, you cannot eat more even if you want to. Suppose imagine you go to a party or you go to a wedding and you want to eat more on that particular day. Sleeve gastrectomy will not let you eat more, whatever you do. In such conditions, some people tend to overeat slowly over a period of time. Like every half an hour they take high calorie food. So in a very limited section of people, it will make you regain your weight. It happens about 10 to 15% of the time. So if you are one among them and if you don't want to undergo that operation, we have a solution for you. It is gastric bypass surgery. So how does it work? So imagine this is your stomach. So in this surgery, we are not going to remove anything from your body. So what we do is, so we make this into a small pouch-like thing. It is a small tube, narrow tube. So we just disconnect this part here from this part. And after doing that, we join your small intestine to this. So this is how it is. Once we do that, this is how your stomach is going to look like. This is how it will look like. So the food that you eat, it will come here and it goes directly into your small intestine. And various hormones that are secreted by your body, they travel like this and join the food here. So once a significant portion of your intestine is bypassed, we bypass depending on your weight and the amount of weight that you want to lose. It varies from 150 to 200 centimeters. Your entire length of the small intestine is about 600 centimeters on an average. So we bypass about 1/3 of your small intestine. As we do that, so though you will be able to eat closer to normal quantity of food, the body will not digest the total food. So let me explain to you in a simpler way. Imagine you have to go from point A to point B. Imagine this is your mouth, this is your anus from where the digested food goes out, and this is the path it has to take. Imagine this is 500 kilometers. So what we do is we put a bypass. So we put an entirely new route. Because of this, the length of this is reduced. So the amount of area that is required to absorb the food has been reduced. So though you take significantly more quantity compared to the sleeve gastrectomy, your body does not digest that food. Most of it goes through your anus through your motion. So you will be able to eat a little bit more than your sleeve gastrectomy, but even then you will be able to lose more weight. In fact, you will lose significantly more weight compared to sleeve gastrectomy. And as the food is being bypassed, even if you tend to overeat on and off, you will be able to maintain that weight throughout your life. So how much do you lose actually? So usually once this procedure is done, people tend to lose 85 to 95% of their extra weight. Say you are suppose 80 kgs overweight. Suppose you have to be 170 kgs. You are 150 kgs. You will lose almost 65 to 75 kgs of your extra weight. So you will come down to 80 kgs. You are closer to your normal weight. So this is how this procedure helps you lose weight. And there is 99% chance that you will not regain your lost weight. And one more important thing is, if you are diabetic, your diabetes will be resolved completely. 99% of the time, your diabetes will be resolved depending on the stage. When you come early, when you are in early stages of diabetes, there will be complete resolution of diabetes in this type of surgery.